So the fecal immunochemical test, as a non-invasive test, is used in an equivalent way, meaning that you can use this test as an option to screen for colorectal cancer with confidence that actually it works almost comparably as any of the tests that we offer are recommended for screening. So who should get this test? That's an important question because anybody who is what we call at average risk, meaning that you don't have the high risk factors for colorectal cancer. And I'll go into each of those in a moment. So the folks who should not get this test, perhaps more important, but the age group that we focus on for screening is 45 to 75 years of age. And within that age group, if you have evidence of bleeding in your stool or blood in your stool that you can see, you should talk to your doctor so you can get the right workup done. If you have a family history of colorectal cancer, you shouldn't do this test, but talk to your doctor. You should have the right counseling and get it done. Certainly, if you have a history of inflammatory bowel disease like Crohn's, ulcerative colitis, this is not the test you want to do first, but you want to talk to your doctor to make sure that you're under what's called a surveillance program because of the higher risk of colorectal cancer. Now, there are some genetic syndromes that people with these syndromes had much higher risk. Lynch syndrome is one example. People who had polyps or found to have polyps in the past, we don't recommend doing this test as the first option. So if you have familial adenomatous polyposis, which is called FAP for short, you shouldn't do this test. Certainly for those people who have these syndromes, they would have been discovered and going through a tight surveillance program or even undergone surgery or treatment. So these are some groups of people who we don't recommend should have this test as a first line for sure.